Welcome to the Rio Rancho Public Schools training for supervising medication self-administration by the RRPS student. This presentation was developed by the Health Services Department to train school personnel in knowing how to handle administration of medications. I'd like to take a few moments to thank all the folks that helped with this presentation. The nurses in the Health Service Department have provided wonderful assistance and contribution to the content of this training. There are just a few things to know about how this training works before we start. Hopefully you've got your speakers working by now. Also, you can probably tell this training will run automatically, but you can control the speed of this training by using the forward and back buttons as well as the pause button to the left to slow things down. You can also read the slide notes on the left, and you might want to keep a pen and pad ready to take notes. Lastly, at the end of this training, we'll have a little quiz for you to take, mostly as a reminder of all the important points. A word of strong caution here: you can pause and even exit this training at any time. But if you start taking the quiz, you must finish it. If you close the training in the middle of the quiz, the software will score you as incomplete and not let you retake the quiz. If you finish the quiz and don't pass it for whatever reason, you can then reopen the training and retake the quiz one more time for a better score. The goals of this training are: help unlicensed personnel understand the importance of student medication administration during school hours and their responsibility and accountability in this process. Understand the importance of proper medication checks and documentation for the safety of the student. Medication can help the student succeed. Administration of prescribed medication while minimizing the risk of a medication error is an objective in this training. Understand the documentation process. Understand medication errors and what to do if a medication error occurs. There are currently 4 options for medication administration in schools. The first option is for the school nurse to administer the medication to students who must take medication during school hours. This requires the medication to be brought from home by the parent and the proper medication forms completed by the parent and/or student health care provider. The second option is for the student to self-administer their medication under the supervision of unlicensed trained staff. The third option applies to specific medications and circumstances. Students may be allowed to carry inhalers, asthma medications, and other emergency medications with them and administer the medication as needed. In any situation where the student carries medications, appropriate documentation and consent forms must be kept in the health office. The last option is for emergent administration of medication in a life-threatening situation. Unlicensed personnel that have received specialized training by the school nurse may administer medications such as EpiPens or glucagon if the situation arises and the student's health condition warrants the administration of the medication in order to prevent death. School personnel authorized to administer these medications are identified in the child's health management plan. In the absence of the nurse, school personnel who complete this training must make sure the student who has prescribed medication to be given during school hours receive their medication at the prescribed time. If the school nurse is unavailable to witness self-administration, a substitute nurse can assist the student with self-administration. If a substitute school nurse is not available, the health assistant or school staff that have completed this training can assist the student with self-administration. Documentation of witnessing self-administration is necessary to satisfy legal requirements and is part of the student's permanent school records. In the absence of the school nurse, unlicensed personnel cannot redelegate witnessing student self-administration of a medication to someone who has not completed the medication training. The student must have medication forms in the health office. The instructions on the medication form must match exactly with the written instruction on the bottle. The medication must be in a pharmacy labeled container or the original manufacturer's package or bottle. This is the form used for administration of a prescription medicine. This must be filled out by the parent and the student's healthcare provider in order for the medication to be given at school. The information on this form must exactly match the instructions on the pharmacy labeled bottle. This is the form that is used for prescription asthma medication. As any students that are self-administering asthma inhalers and are carrying inhalers with them at school must have this completed form on file in the school health office. This is the form used to administer over-the-counter medications for students at school. Students may not carry OTC medications with them. All over-the-counter medicines must be kept in the school health office with this form on file before it can be given at school. It is important that these principles of medication administration be known and followed by anyone involved with student medication administration. Medication administration is a clean procedure. Make sure the student washes their hands before taking their medication. Make sure the medication is given exactly as the health care provider orders or manufacturer's recommendations. The instructions on the pharmacy labeled bottle or package must match exactly with what is written on the medication permission slip. It is your responsibility to make sure that the student takes their medication and at the time prescribed. If they miss their medication, it is considered a medication error and documentation must be made. Prevent errors by avoiding distraction. Keep all student information private. If there is a medication error, you must follow the district procedure to report the error. Complete a medication variance report. Notify the parent and school administrator. Anyone who gives medication or assists students with medication must know the 6 rights of medication administration. Each of these rights should be checked 3 times before the medication is taken by the student. Always triple check the medication name and the student name before the student is allowed to take the medication. Be aware of the purpose of the medication and the major side effects. When in doubt, look them up. You may want to get with your school nurse to review medications given at your school. She can review with you the purpose of the medication and the possible side effects. Any questions you have concerning the medication should be addressed with your school nurse before it is necessary for you to assist with self-administration. Triple check the time the medication is to be given. Verify this time by looking at the pharmacy bottle or original package and the medication permission slip completed by the parent. Some medications should not be given on an empty stomach. This will be marked on the bottle or package instructions. Make sure the child has eaten prior to medication administration to prevent side effects. Some medicines are ordered 4 times a day, which is 6 hours apart. Some medications are ordered 3 times a day, or 8 hours apart. Some medications are ordered 2 times a day, or 12 hours apart. And some medications are ordered with meals. Make sure the time the medication is being given according to the instructions of the parent or the healthcare provider. Know your student. Ask their name, ask staff for help if you cannot positively identify the child by sight. Pictures are sometimes used to identify individuals. Check the student's medication health management plan if available. Additional pictures can be found in the student's COOM folder. Students' pictures are also available on SASE. Ask the student his name and double-check the name with the medication package. Do not say, "Are you so-and-so?" Know the usual dose of the medications. You may look this up if needed. Question dosages that seem out of the ordinary or do not agree with the package labeling. Do not allow the student to take the medication if the bottle and the prescription slip do not match exactly. Contact the parent to notify them that the medication cannot be given due to the discrepancy. Check 3 times to make sure that you have the correct dose before allowing the student to take the medication. Make sure you have the right route, for example, oral or topical, etc. One route must never be substituted for another route without a written order from the student's healthcare provider. Check the medication record to make sure the medication has not already been given for that day. Check the medication record for all of the information in the 6 rights. If the child has correctly identified himself and the medication may be administered. This is the form used by RRPS to document a medication has been given. After the medication is given, document on the medication record the time and your initials in the corresponding box for that day. Be sure to place your signature and initials at the bottom of the form where indicated. Students who are capable of self-administration should be able to identify their medication by recognizing their name on the bottle, giving the name of the medication and the reason they are taking the medication, know the time the medication should be taken, and why they're taking the medication. Only a nurse can take a verbal order for medication or medication changes from the student's healthcare provider. Any medication errors must be reported to the nurse, parent, appropriate staff, and a medication variance report must be completed and filed in the student's purple folder. Examples of a medication error include the wrong medication given to the wrong student, the wrong amount given, a missed medication, or medication given past 30 minutes before or after their scheduled order time, or not given at all. All medications should be kept in a locked cabinet in the nurse's office unless the student has written permission to keep the medication on their person during school hours, or the medication requires refrigeration. Medication refrigerators should be kept in a locked office and should not contain food or drinks. Administration of medication is a clean, not sterile procedure unless otherwise specified. Check the authorization from parent with the label instructions. Seek help when questions arise. Prepare and give medication in a well-lit, dedicated area. Remove the medication from a locked cabinet. Check the medication for correct information matching the label with the written instructions on the medication form. Seek out resources if any of the information is unclear or not understood. If possible, pour a single dose of the medication into the bottle cap or medication cup without touching the medication. Take only one student's medication out of the medication cabinet at a time. Do not take several students' medications out and line them up in front of you. Check the label against the medication permission slip while preparing the correct dose. Check the label against the medication permission slip before returning the medication container to the locked cabinet. Do not leave the medication unattended. Provide the student with the necessary supplies to take the medication. Identify the student by asking the student to say his or her name. Nonverbal students may need third-party assistance with identification. Take measures to maintain data privacy. Verify the student allergies verbally by asking the student and checking the student health records. Also verify contraindications to the medication. Watch for typical adverse medication reactions. If an adverse reaction is evident, contact the parent, legal guardian, the healthcare provider, and another school nurse. Call 911 if necessary. If the student questions whether it is the right medication, stop and verify the medication against records or with the parent or legal guardian. Explain the procedure to the student. Watch him or her take the medication. Some students will need to open their mouths and lift their tongue to make sure the medication was swallowed. Administer medication according to the 6 rights: the right student, the right time, the right medication, the right dose, the right route, and the right documentation. Record the time and your initials in the appropriate medication calendar box. Note any unusual observations if appropriate. If a medication is dropped or wasted, note the wasted medication on the medication form to account for the dose. Dispose of any drinking cups or medicine cups if appropriate, and wash your hands before returning to work. As needed or PRN medications are medications that can be given on an as-needed basis. It may be requested by a student and based on the health assistant's observations and the nurse's judgment of safety and individual need. Only a nurse or parent may make the decision to give over-the-counter medications. The medications must be brought from home in the original container and have the necessary forms completed by the parent. All medications must be labeled with student's name in the original manufacturer's container or pharmacy labeled container. Medication must be locked in a cabinet unless refrigeration is required. Refrigerated medication cannot be stored with food. Medication refrigerators should be located behind locked office doors. Only those persons who have received the medication training should have access to the locked medication cabinet. Oral medications and topical medications must be stored on a separate shelf. Be sure to document the receiving or disposing of controlled medication on the controlled medication documentation form. Witness and count controlled substances with another adult or employee and initial where appropriate. Medications that are outdated, expired, or contaminated should be discarded according to district policy. Over-the-counter medicines may be sent home with students in middle school or older if their parent has signed the appropriate box on the medication slip. All other over-the-counter medicines must be picked up by the parent or discarded according to district policy. This is the medication documentation form that you will use to document when you receive controlled medications. The student's parent or the student under the supervision of the school nurse will prepare an envelope with a single dose of the medication for administration during a field trip. The envelope should be labeled with the student's name, medication, dosage, route, and time medication should be given. Once the trained staff receive the medication, it is their responsibility to make sure the student receives the medication at the appropriate time and sign the medication form with the time and their initials once they return to school. Medication health management plans may be written by the nurse in order to help school personnel understand medication particulars for a student receiving medication at school. This is done on an individual basis. Check with your school nurse to see if a medication health management plan has been developed. Please review all district medication policies and procedures. The medication policies are found on the district website. Medication procedures are found on the intranet in the Health Services documents under the School Health Manual, Section 6. Any medication questions should be reviewed with your school nurse. Now it's time to take that short quiz I mentioned. Just click on your answer for each of the 4 true-false questions that follow. Take your time and be sure not to exit during the quiz. You can always retake it for a better score later.